Myalgic encephalomyelitis, ME, is a complex chronic condition affecting multiple body systems. There is currently no cure or established treatment. The symptoms of ME go far beyond chronic fatigue or being very tired. The sickest patients lie alone in darkest rooms, and sometimes they're unable to move or speak, or in the very worst cases, to swallow or to digest food. Even at the mildest end of this condition, people with ME, who once had lives, hopes and dreams for the future, live a shadow of their former lives. More than 5 years on from the start of the COVID pandemic, it's timely to note how the numbers affected have increased. Approximately half of those with long COVID go on to meet the diagnostic criteria for ME. So now it's estimated that 1.35 million people live with ME or ME-like symptoms. This includes healthcare workers and teachers and other key workers who kept our country running at the height of the pandemic. Adding carers and even more are directly affected. And importantly, there's a gender dimension where women are 5 times more likely than men to develop ME. Despite the devastating toll of the condition, people with ME have endured decades of substandard and sometimes downright unsafe healthcare and pitifully little funding for research.
Will she give way on that point?
Sure.
I thank my honourable friend for giving way and for bringing forward this important debate. So according to at least one survey, about 66% of sufferers do require some form of social care, and as is the case for some of my constituents, it's their own families who put their lives on hold to provide that care. So will she join me in stating that this is just one example of where the government must address social care if it's going to get health and social care right?
Couldn't agree more. For far too long, patients have been dismissed, and that care element is incredibly important. It affects so many people. So, in spite of a lack of robust evidence to this effect about the funding for research, it's treated as though the condition is psychiatric. In July this year, the Department for Health and Social Care published the final delivery plan for ME, a cross-government strategy aiming to improve attitudes, bolster research and better lives. It included some positive steps, new small grants for research, into repurposed medications and the development of a new service specification for mild and moderate ME. However, overall, the consensus view of charities and patient advocates I've spoken to is clear. The delivery plan falls far short of what was needed. I'll highlight 4 areas where we need to see much more from the government going forwards.
Will my honourable friend give way? I'm grateful to my honourable friend for giving way, and I'm interested in what she's saying about plans in England, because in my constituency of North East Fife, we were privileged to have an incredible ME specialist nurse, Keith Anderson, who helped countless people, but he very sadly passed away 2 years ago, and since then there has been no specialist support in Fife, and indeed there is no specialist ME doctor or nurse in the whole of Scotland. Does she agree with me that one of the things any plan needs to consider is training, so that no matter where you are in the country, you can get access to a specialist?
Yeah, I would agree, and in fact it's not just, we don't just need specialists, we need to make sure that there's some training for GPs and other healthcare workers as well. So, given the gravity of the situation, I would really appreciate it if the Minister could arrange for written responses to the number of the points that I make. So the first point I wanted of the 4 is on funding. If the plan felt threadbare, it's because there's no substantive new funding attached to it. Before the plan was published, all 72 Lib Dem MPs signed a letter expressing our concerns about the anticipated lack of funding, which of course came to pass. To put it bluntly, what patients need is transformed NHS care and a step change in research. Neither is likely to happen without investing some money. The case for investment is clear. I would urge the Minister to see this not as a sunk cost, but as an investment in a group of people who are desperate to contribute to society. We know that 1 in 5 working-age adults is out of the workforce, many because of health problems, yet remarkably, there was no modelling of the demography for those living with ME for the delivery plan exercise, and neither the Department for Health and Social Care or the Department for Work and Pensions have an estimate of what neglect of people with ME is costing our economy. But I'd like to look at some of the figures. The most recent estimate of the economic impact of ME was for 2014-2015, 10 years ago, carried out by 2020 Health. The cost was then calculated at £3.3 billion annually, based on only 260,000 people living with ME. With many more affected following the pandemic and a decade of inflation, this cost will now be much higher. Even the most conservative estimate of current numbers living with ME, excluding cases linked to long COVID, puts this at 404,000 patients. Does the Minister accept, using this conservative estimate and adjusting for inflation, the annual economic impact of ME today is likely to be at least 7 billion? And that, if those living with ME-like symptoms following COVID are included, we could be approaching an annual cost of 20 billion. Surely it's time for the government to properly cost the impact of a condition that affects so many, rather than brushing it under the carpet, and to invest in accordingly.
On that point, I'm very grateful to my honourable friend, and she's making a very strong case. Of course, she'll be aware that there is significant uncertainty still as to where, amongst many clinicians, as to whether this should be treated as a medical rather than a psychological condition. But does she not agree that, in fact, because of the gravity and the extent of the cases that exist around the country, it is really important that medical services are supported in dealing with at least all of those patients and their symptoms?
Indeed, I accept the point that he makes. I think most of those people whom I speak to say this is nothing to do with psychiatry. This is actually we now have evidence from Edinburgh, which I'll go on to in a moment, to explain exactly why that's the case. Our counterparts in Germany have grasped the importance and scale of this challenge. Just last week, the German government announced a national decade against post-infectious diseases, with a particular focus on ME and long COVID. In Germany, an estimated 1.5 million people are living with ME or long COVID. The German government has rightly recognised post-infectious diseases such as ME as one of the greatest public health challenges of the 21st century. Last week, they committed €500 million, around £440 million, over the next decade into research to understand the causes of post-infectious diseases and to develop treatments. Can the Minister confirm whether ministers at the Department for Health and Social Care has discussed this recent funding announcement and the logic behind it? I'd love nothing more than to see the UK government come up with a comparable level of commitment. Or will the government be waiting for a decade for the German government's conclusions before taking actions itself? Briefly.
Chairman, can I commend the Honourable Lady for bringing this forward? In Northern Ireland, unfortunately, the figures for ME have risen from 7,500 to 12,500 in the last few years. We have no clinical lead, no specialist service and no commissioned care pathways. But what we do need to have is research. Queen's University in Belfast are really good with partnerships when it comes to research. Does the Honourable Lady agree? Spend the money in research, find the cure. If we can find, they said the cure for cancer will come in 10 years' time. Well, the cure for ME could come if the research money was put into it.
I agree, absolutely. Thank you. The second point where I'd urge the government to go further is on support for people with severe and very severe ME. It's estimated that around 1 in 4 people with ME are severely affected. ME is perhaps the only condition where the sicker you become, the less care you receive from the NHS. Indeed, the recent Prevention of Future Deaths report, focused on the tragic case of Maeve Boothie O'Neill, described NHS care for severe ME as non-existent. In my work on this issue, I've collaborated closely with There For Me, a campaign that was founded by 2 women, Karen and Emma, who are carers to partners with very severe ME. It can be difficult to comprehend the depth of suffering that ME can bring in its most extreme forms. Karen has, with his permission, shared details with me about her husband James's day-to-day life. Before developing ME, James, in his 30s, lived a full life. He was a civil servant. Today, he's completely bedbound, spends 99% of his day alone in a dark room, unable to tolerate any noise, light, or stimulation. He's hardly able to communicate and is so sensitive to the touch that, despite his suffering, his wife Karen is unable to give him a hug or hold his hand. And despite an acute level of need, he is receiving next to no care from the NHS. Karen tells me that her biggest fear is that James deteriorates to the point of needing life-saving care. She cannot feel confident that the NHS will provide it. Indeed, briefly.
I thank her for giving way. She's making an incredibly powerful speech. One of my constituents from Leeds South West and Morley, an NHS nurse, suffers with ME and he can't play with his children. Can't walk his dog, he can't do basic activities. Now, when he went to the NHS, they told him, they got a referral, but they told him it would be 9 months before he gets an appointment, forcing him to consider private options. An NHS nurse is having to use private healthcare to get results. This is untenable, isn't it?
It's not only untenable, it's completely absurd. So, indeed, in September 2024, for World Patient Safety Day, over 200 healthcare workers were so concerned about NHS care for ME, and particularly severe and very severe ME, forgive me, let me finish this, please, that they wrote a letter to the Health Secretary calling for immediate action to save lives. This was 14 months ago, and I'm sorry to say very little has changed since, nor did they ever receive a response. I'll give way very briefly.
I thank the Honourable Lady for giving way. I just wanted to mention very quickly one of that 25%, my constituent Alice, who is in those circumstances, who cannot leave her room, who is scared to call for treatment in case she has to go into hospital because she's been into hospital twice and people aren't sure how to treat her and make it worse. So I simply wanted to empathise on behalf of my constituents and say one of them is in one of those very severe cases that the Honourable Lady is talking about.
Thank you, and I think probably most of us would have constituents in exactly the same situation. So, within just over a year, 2 prevention of future death reports have been issued related to severe ME. One I've already referred to, Maeve Boothby O'Neill, and Sarah Lewis. Neither has yet resulted in satisfactory action, and the risk of death, specifically from malnutrition, is real and ongoing. Earlier today, I spoke with Dr. Benita Kane, a private sector clinician with a special interest in ME and long COVID. She told me about the case of a 25-year-old woman, a medical student, who developed severe ME after a viral infection in 2018. She's been in an acute NHS hospital for 17 months with nutritional failure and has deteriorated to the point where palliative care is being instituted. Her family is being prepared for the worst. This is dreadful. The young woman has been disadvantaged not because of the individual clinical decisions, but because she suffers from a condition for which there is no safe or established service model. There have been multiple missed opportunities to prevent her condition progressing to this stage. Sadly, she's not alone, and I've heard so many other cases today and before today. And what's being done to help patients like her? In the forward to the final delivery plan, the Minister stated that tragically avoidable deaths of people with ME CFS in England must become never events. But the plan does not clearly set out what actions the Department will take to guarantee patient safety. No one is being held to account. The plan committed DHSC and NHS England to explore whether specialised service should be prescribed to the Secretary of State for Health for very severe ME and CFS, and I hope the Secretary of State will do the right thing and commission that service. But it's frankly astonishing that the option of leaving this group of patients without specialist NHS care, as they are now, is even on the table. I'll ask the Minister to clarify what progress has been made in commissioning this service. Not to mention that developing a new service from the ground up is at best a medium-term solution. It may take years. Again, it's astonishing that no interim solution has been proposed to ensure that patients with very severe ME, whose lives are at risk right now across the country, don't become tomorrow's mortality statistics. How many more preventable deaths will it take? So I'll ask the Minister to commit to working with groups like There For Me to rectify this immediately. For example, through the convening of a national advisory group to advise in these cases and undertaking a full review of the lessons learned from ME deaths. And can the Minister clarify what data is being collected to better understand the number of those with ME who are affected by life-threatening complications? My third point is that I'd like to see the Government doing so much more on accelerating ME research. I spoke earlier about the need for investment in research and improving healthcare. For many patients, biomedical research represents their very best hope of regaining their former lives. Yet the condition has historically received very low levels of research funding from the UK Government. Based on parliamentary answers and official announcements, I estimate around 10 million has been invested in ME research over the past 12 years. To put this into context, with current numbers, that's about 60 pence per person living with ME per year. 4 times as much was spent on a helicopter for the former Prime Minister that's been spent on ME. We spent 125 million, 12 times as much, on a back tunnel for HS2. And we spent 10 billion, about 1,000 times as much, on PPE that turned out to be unusable. Money talks. And for the record of the past decade, makes one thing clear for people with ME: their collective futures have been valued by successive governments at astonishingly little. I'm going to carry on, if you don't mind, forgive me. The final delivery plan rightly points to the need to build capacity in ME research, given the small UK research community and very few funded research projects. The University of Edinburgh's Decode ME project has been a notable exception, recently reporting groundbreaking findings that revealed distinct genetic signals in people living with ME. This is medical, not psychological. This gives us a solid and compelling foundation for future research. Can the Minister explain what plans are in place for future funding to capitalise on this research? But again, the delivery plan is light on actions to build UK capacity in ME research. So, a consensus recommendation for a post-infectious disease research hub was not funded. A joint showcase event was held earlier this month by the National Institute for Health and Care Research and the Medical Research Council, with the goal of stimulating research. Yet it's not clear whether this will yield tangible results or how its outcomes will be monitored. So again, I ask the Minister, what is the plan if, as seems quite possible, it's not a lack of information that's holding back capacity, but secure long-term finance to encourage researchers to build a career in the field? The final delivery plan gestured to heritage and crime, which were effectively pre-existing funding announcements. The only genuinely new funding announced through the plan from the National Institute for Health and Care Research for research into repurposed therapies was capped to grants of £200,000. The government's response on this issue, including in the letter that was sent in response to concerns raised by the 72 Lib Dem MPs, tends to be that it's not usual practice to ring-fence funds for specific conditions and that researchers can apply for funding in open competition. Yet, historical funding imbalances mean that it's not simply realistic to expect ME researchers to compete with researchers of diseases which benefit from more advanced research and much stronger institutional capacity. Not to mention that the UK government does, in fact, set aside funding for specific conditions when they're considered a strategic priority. Just this June, £50 million of funding was announced for cardiovascular disease research to be awarded through open competition. In 2021, £50 million was committed to research into motor neurone disease. If we can award ring-fence funding through open competition for these conditions, why not ME? To echo a question asked at the recent research showcase event, why is ME not considered a strategic research priority? Can the Minister clarify this? My fourth and final point, where I'd like the government to go further, is on support from wider departments, in particular the Department for Education and the Department for Work and Pensions. Children and young people are uniquely affected by ME. The condition disrupts and can derail key life stages and developmental milestones. Among educational professions, poor understanding of ME contributes to a lack of adjustments, limiting access to education and increasing school absences. The final delivery plan acknowledges the need for access to education and improved life chances amongst children and young people with ME. But while this is in theory a cross-government plan, engagement from the Department of Education seems to have been extremely limited. Can the Minister outline what engagement has taken place so far? And can the Minister commit to speaking with colleagues in the Department for Education to ensure they will engage with the delivery plan moving forward and they will ensure that children and young people with ME receive appropriate accommodations? Meanwhile, welfare benefits are the most common issue that constituents with ME raise with me. Many have struggled for years to access the benefits they're entitled to, feeling that they're fighting a system that's working against them. And like most people living with disabilities, my constituents are terrified at the prospect of future welfare reforms and losing support that they have and rely on to meet their basic needs. Looking at this current situation, I'm indebted to a benefits advisor focusing on ME for her summary. Quote, people with ME face intersectional and compounding barriers when interacting with the Department for Work and Pensions. These include structural flaws in benefit design, widespread misunderstanding of their conditions, systemic disbelief, inaccessible systems, poor quality assessment practices, and the cumulative harm of being required to repeatedly prove their illness. The current benefit system and emerging reform agenda both fail to reflect the fluctuating, energy-limiting, multi-systemic nature of these conditions. And then the Universal Credit Act 2025, together with the proposed abolition of the work capacity assessment and ongoing threats to PIP eligibility, signals a fundamental shift in how disabled people meet the entitlement to financial support. I'm particularly concerned about the proposals to replace the new style ESA with a time-limited unemployment insurance and to abolish the work of capability assessment. Replacing the new style ESA would disproportionately harm individuals who are not eligible for means-tested support, for example, because their partner works. Among other harms, this increases risks to domestic abuse by heightening financial dependence, a particularly pressing concern given ME is considerably more prevalent in women. Abolishing the work capability assessment removes critical safeguards. In Regulations 29 and 35 of the ESA regulations, for those whose health would be seriously harmed by work or work-related activity, these protections are vital for people with ME who are at particular risk of harm and long-term health consequences if they push beyond their energy limits. Time prevents me from providing more detail on this, but I would conclude that with my observations that on the whole, what people with ME want most is to recover their capacity to contribute to their families, to community and to wider society. They hate being ill. An appropriate benefit system to our country must acknowledge this and treat them with dignity and fairness. And the way to get people with ME, and indeed those caring for them, back into work isn't taking away crucial support, it's investing in helping them to get better. There will be many who are watching this debate from home, desperately hoping that we're doing everything we can to build them a better future. They deserve the assurance that there is commitment from this government to clear, ambitious and, crucially, a properly funded vision for change across healthcare, research and all forms of government support. I'm going to ask the Minister for a meeting to discuss myalgic encephalomyelitis and the way forward for the 1.35 million people affected, and I very much hope that today's debate represents a big step forward in delivering this forum. Thank you.
I remind members that they should bob if they wish to be called in the debate. The question is that this House has considered government support for people with myalgic encephalomyelitis. It is clear that we'll have to have a 3-minute time limit if we're going to try and get everybody in, but I can't guarantee to do that. And I call Joe Platt.
Thank you, Mr Mundell, and it's an honour to serve under your chairship. And I want to declare my interest, as I am chair of both APPGs for ME and long COVID. But I really do want to thank my honourable friend for bringing this really important debate to the House today. And we work together on the APPG for ME. So ME and related conditions such as long COVID are among the most devastating illnesses of our time. Yet they remain some of the most poorly understood and neglected. Unless we confront this misunderstanding head-on, we will never deliver the change that patients so desperately need. Now, this issue is really personal to me. So in 2020, I contracted long COVID, and the infection was mild. The aftermath was devastating, and it changed my life forever. With long COVID, I developed ME. So I know the exhaustion, the isolation and the gaslighting that patients face. And I cannot know for sure why I improved, but I believe one reason was early recognition. My friend, and I'll give a big shout out to her, Shelley Guest, she saw my symptoms mirrored her own, and she gave me books. She shouted at me and told me to pace, and to her I'm forever grateful. But this raises a critical question. If diagnosed and supported early enough, could symptoms be managed to the point of recovery or partial recovery? My journey isn't over yet. But that is why research and recognition are not optional. They are essential. I'll give way.
I thank her for giving way and thank her for the work that she does as the chair of the two groups that she mentioned. My constituent Janet has contacted me about her son Richard. He was diagnosed with chronic fatigue syndrome 6 months ago, and as she's just described there, he's still waiting for a proper referral, having had a diagnosis. Does she agree with me that that early pathway is absolutely vital, and would she encourage the Minister today to outline how, what form that may take?
I agree, and I recognise every single one of them issues. And again, as chair of the APPG, we get to hear of the harrowing cases day in, day out of what people are struggling with pathways into healthcare. It's simply not good enough. I'll give way.
I hear from so many constituents that actually people suffering from ME have the lowest quality of life from any condition that being suffered. Is it not also the case that people simply do not understand what ME is?
I completely agree, and I mean there is also confusion, and again what my colleague has just mentioned there with regards to what chronic fatigue is and ME is, and there needs to be a differential. There needs to be more clarification on what each condition is. We all get fatigue and chronic fatigue, but obviously ME can be something different. So there does need to be more clarification. As I say, it's not just tiredness, it's a complex issue. So many of the severely affected, as we have just heard, cannot even sit upright. They are confined to darkened rooms, often tube-fed, cut off from the world and too often ignored by the very health system that is meant to protect them. Long COVID has only added to this burden, with millions now affected and half of whom do meet the criteria for ME. So next Tuesday, Parliament will host the first drop-in session by the Overlapping Illness Alliance, which will raise the awareness of ME, long COVID and related conditions. And I urge colleagues across the House to attend. So the government's ME delivery plan is a welcome step. NHS e-learning, service specifications and small research grants are progress, but they are not enough, particularly for severe ME. The scale of the challenge demands ambition, accountability and strategic investment. We need specialised NHS services for ME. We need urgent support for children whose education is disrupted, and we need coordinated action across health, social care, education and employment. Research is central to progress. Decode ME has shown the brilliance of UK science, but funding remains far too limited. So Germany has pledged €500 million to research with the aim of curing ME by the next decade. We need to be just as ambitious. But we must also confront the misinformation and the bias that has plagued ME for decades. Patients are dying from nutritional failure because there is no commissioned service for severe ME. Some spend hundreds of pounds in hospital, on private care, without a proper pathway. So lives are at risk now, and we cannot wait for long-term provision while patients suffer. So that is why, alongside the APPG, I'm calling for the commissioning of specialised NHS services for severe and very severe ME with expertise in nutritional failure. And I would welcome the chance to meet with the government to discuss immediate solutions that can save lives today. And also, will the Minister commit to improving data collection so that we can better understand risks and create the foundations for effective care? So, yes, the government has taken steps in the right direction, but more must be done. And as chair of both APPGs, I'll continue to work with the community, to work with government to do that.
Yeah. Jeremy Hunt.
Thank you, Mr. Mandela. It's a privilege to speak with you, and I'd like to thank the Honourable Member for Wells for calling this debate. I'd like to use my very short time to tell the story of a young man who made me understand the tragedy of ME. 6 years ago, he was a very promising first-year student at Durham University called Tom. He was on track to get a first in maths. He was a big hockey player. And then in his second year, he started struggling. First to walk upstairs and to climb hills. And eventually he found he couldn't wash himself or eat by himself or even read. And then, to his enormous frustration, in his third year, he dropped out. And when all his friends were starting their new lives with their first jobs, he had to stay at home and go through the nightmare of, first of all, trying to get a diagnosis, trying to get someone to actually agree that he had a problem, and then secondly, to try and get treatment for that. And he felt that he was going in circles, that doctors weren't really persuaded, and he just wasn't getting any answers. Now, he was very lucky because he had two remarkable parents, Alex and Denise, who were also able to afford to go to America. In fact, they moved to America, and they got him enrolled on clinical trials. And this story actually has a positive ending because 6 years on, he is doing incredibly well. He's actually thriving. He's got a job. He's got a partner. His life is back on track. except sadly in America rather than here. And as the Honourable Member for Wells said, there are 400,000 people with ME or long COVID symptoms that are like severe ME. And for some of them, it's already too late. Boothby O'Neill and Sarah Lewis tragically lost their lives, and coroners issued prevention of future deaths notices. And things are better now. The NHS, I'll happily give way to
Sarah Lewis was a constituent of mine, and I've got here the report to prevent future deaths that was issued after the inquest. And one of the things, I mean, she took her own life, but she was severely ill with ME. One of the things that comes through very strongly in this is the fact that she didn't feel that she was believed, she wasn't taken seriously, her symptoms weren't recognised by the medical profession. And that is so important that we challenge the medical profession to take it more seriously.
Well, I would like to thank the Honourable Lady for bringing up that very sad case. And I do think that because of long COVID, actually, the NHS is better than it was. But I think the real cause for hope is the Decode ME study at Edinburgh University, which the Chief Executive of Action for ME, Sonia Chowdhury, described to me as like a treasure hunt map where they've got 8 crosses where there's a genetic code matching ME. But then we've got to go and dig up that treasure. And that is the thing that is now waiting to happen and why funding is so important. And ultimately, with the quality of research that happens in this country, there should be no need for anyone to have to go to the United States or Germany for their treatment. More lives were saved through treatments and vaccines discovered in this country during the pandemic than those from any other country in the world. And we have got this amazing research happening here. So this is really my plea to the government. The last government started the process by ignoring some of the scepticism in the medical community about whether this really was a serious condition. But it would be so fantastic and give so much hope if this government could now finish the job and invest in that research that will transform the lives of so many people like Tom.
Alison Hume.
Thank you, Mr. Mundell. It's an honour to serve under your chairship. A constituent recently wrote to me saying, ME has taken almost everything from me. I can no longer work. I am mainly confined to my chair or bed, and on the rare occasion that I leave the house for medical appointments, I need to use a wheelchair or walker, and it often results in PEM, which is post-exertional malaise. It was that sentence that really stayed with me. ME has taken almost everything from me, because it seems to sum up the decimating effects of ME for the 25% of sufferers who experience the most severe symptoms. ME takes, and it takes some more, until in too many tragic cases the patient dies. The fate of patients with severe ME has really been brought home to me through my involvement with my constituent Debbie Seymour, once a working mother of 2, but now into her 3rd year of being bedbound in a dark room and principally being cared for by incredible mum Sylvia, who herself is in her 80s. Although nurses are offering practical support, there remains a lack of knowledge about severe ME among healthcare providers and the allied professions, particularly about the nature of the key diagnostic symptom of the disease, PEM. Too often, sufferers from severe ME are required to fit into NHS pathways and procedures which suit the system but take little account of the human being at the centre. I welcome the government's delivery plan on ME. One of the stated aims is that DHSC and NHS England will explore whether there should be a specialised service for very severe ME. I wonder if the Minister, in a summing up, could confirm that this exploration will still go ahead as NHS England is in the process of being dismantled. The desperate experiences of so many point up a lack of research into the disease. Perhaps the Minister may also be able to reassure my constituents in Scarborough and Whitby that there is a future where the ring-fence funding which has been granted to other illnesses can be extended to ME. In conclusion, Mr Mundell, I have felt helpless when it comes to supporting my constituents in Scarborough and Whitby who suffer from severe ME and their families and carers. So I'm putting my faith in this Labour government to drive forward the research to find a cure for this devastating disease and improve specialist care for seriously ill ME patients like Debbie before it's too late.
Oh, Adam Dance.
Thank you, Mr. Chair. It's a pleasure to serve under your chairmanship. I'd like to thank my honourable friend for securing this vital debate and for her work campaigning on this. With the time I have, I'd like to share the story of Iona, who was diagnosed with ME in 2019, but has been unwell since 2014. Her ME causes a range of horrible symptoms from physical and mental fatigue to muscular weakness. She was housebound for 4 years and cannot do anything independently. Iona tells me the biggest barrier to support is limited or damaging knowledge. She says that as a chronically ill young woman, I'm constantly looked down on and dismayed, while at the same time expected to act as if I am not disabled.
My honourable friend give way.
Of course I will.
I thank my honourable friend for giving way. He raises a really important point. One of my constituents, Nick, has described the way he feels as like being stuck in a well without anyone there to pull him out. Don't you think there needs to be more action from government, from the NHS, from businesses, schools, colleges to counter the misunderstanding and the neglect that ME sufferers receive?
I agree with my honourable friend. I think it's really important that the government do put more support into ME because it does affect a lot of people's lives. Yeah.
I'm very grateful to the honourable gentleman for giving way. And I wonder if he'll give me the opportunity to give a shout out to ME Group Staffordshire, who do wonderful work supporting my constituents in Newcastle Lyme and in surrounding communities too. He talks about challenging the stigma that ME people living with ME have to face on a daily basis. These groups are doing so much to challenge that, and as the Minister looks to provide support that we're all calling for, I hope that support will be extended to some of those support groups and communities supporting people like my constituents.
I agree with the honourable member. We need lots more support groups across the country, and it's really good that you have that in your constituency. Her school offered no help and told her she'd fail all her GCSEs. She went to her GP and other doctors so many times but was told she was either anxious, did not know it, did not want to go to school, was depressed, or that nothing was wrong at all. Anyone who knew her knows that this is ridiculous. She is a positive, determined, intelligent and hard-working person, and it is only because of the determination that she got support, but only because she pushed for herself with support from her family. You should not have to be a medic. You shouldn't have to be an admin expert to get the support you need. Even then, limited knowledge meant Iona was told to do graded exercise therapy, which did more harm than good. The Somerset ME service provided helpful advice and medical letters that unlocked support in education and from the council, but it's a short-term service that cannot provide medical care, and Iona often found GPs did not understand that service. She still gets little to no medical help today. So it is great that the NHS has rolled out training on ME, but those like Iona who have ME, who have lost trust, need to hear how we can monitor the uptake of the training and change attitudes and stigma in medical profession. That is so important. Yet the ME delivery plan more broadly lacks clear accountability, structures, and has no proper way to measure impact and no clear deadline to meet. I hope the ministers can set out answers to these concerns today. Greater funding and support for research is also vital. Germany has pledged €500 million to research on ME and a cure. It is time that this country steps up to and shows the same ambition. We owe Iona and all those like her with ME at least that much. In fact, Iona herself wants to contribute to the research and is now at university studying hard after getting fantastic results at school. People with ME are not asking for much. They just want to be believed and get the support they deserve. It is about time they got that support. Thank you, Mr. Chair.
With apologies, I'm afraid, to those others who wish to speak, I'm going to have to go to Lib Dem spokesperson Helen Maguire.
It's a pleasure to serve under your chairship, Mr Mundell, and I thank the Honourable Member for Wells and Mendip Hills for securing this vital debate on such an important issue as myalgic encephalomyelitis. This chronic condition completely changes people's lives, as we've heard today, and my constituent, who loved her job as a nurse, was diagnosed with ME in 2019. She's been left unable to work, relies on a mobility scooter to get around, and is often confined to her bed for days on end. Since her official diagnosis, she's experienced constant muscle pain, severe headaches all over, which frequently prevent her from sleeping. Despite battling with a myriad of health challenges, one GP asked her, "What do you expect me to do about it?" Reading this stopped me in my tracks, and what's worse, this reaction isn't isolated. I contacted the local NHS trust on behalf of my constituent. Their locally commissioned NHS chronic fatigue services, which include ME, have been suspended. They've been suspended as they can't cope with the number of referrals to the service. I will give way.
Thank the lady for giving way. It sounds like the experience of her constituent mirrors that of my constituent Emily in Edinburgh. And even although health has devolved, we face the same situation. Does she agree with me that even though Edinburgh, as the gentleman from Godalming and Ash said, is leading the way in research, it's about the experience of people actually dealing with health services that we need to look into?
I absolutely, fundamentally agree.
To them having any additional time.
Fine, thank you. This builds into the bigger picture of a healthcare system that's simply not set up to support those with the most complex and devastating conditions. People with ME who rightly rely on health professionals for advice, support and solutions cannot be abandoned just because their diagnosis doesn't fit into a one-size-fits-all treatment plan.
Will my honourable friend give way?
Briefly.
We've heard just how little money is being spent on research, comparatively speaking, and the Decode ME study has already been mentioned that is identifying genetic signals linked to immune and neurological pathways, offering real clues to the biological mechanisms of this disease. So does the honourable member agree that the government must finally adopt a strategic and properly funded research programme?
I absolutely agree with my honourable friend. And whilst I welcome the government's first delivery plan for ME and chronic fatigue syndrome and recognise the contribution of the ME community in shaping it, I remain deeply concerned that the plan falls short of delivering the meaningful change urgently needed by people living with these conditions and reaffirm the calls rightly made by my honourable friend for Wales and Mendip Hills. In particular, the plan fails to set out dedicated funding to encourage early career researchers to specialise in ME research or strategies to keep established researchers in the field. This is vital to develop new pathways that enable people to better cope with their diagnosis and, most importantly, improve their quality of life. Funding is also needed to step up education and training to improve understanding of the condition across the public sector and to pilot new approaches that strengthen the quality of care. Recent figures estimate that over 400,000 people in the UK have ME. Around 50% of the 1.9 million people in the UK with long COVID are also thought to have symptoms that are very similar to ME. These figures make it clear that there's a desperate need for research to develop better treatment options and training for doctors, carers and wider healthcare workers. We cannot ignore that making these changes is a big task, and under the previous Conservative government, cuts only made supporting people harder. From slashing health services, letting wait times pile up, and overseeing a horrifying breakdown of community services, it's no wonder more and more people are suffering without support. And this is why I urge this government to make sure the final delivery plan delivers real change to people living with ME and invest properly in research to change the course of diagnosis and treatment for good. For my constituent and for those living with ME across the country, we must take serious action to ensure their experience with the healthcare system is rooted in dignity and care.
Shadow Minister Dr Luke Evans.
Thank you, Mr. Mandel. And I tried to take a positive outlook. So the one thing the pandemic did do is shine a spotlight on the likes of long COVID and ME that I know from my medical career how difficult that can be. And I'd like to place on record my thanks to Sajid Javid, who in 2022 announced the plan for ME, and congratulate the Minister in her place because she was the one who brought it to fruition on the 22nd of July 2025. But there is some similarities between the NHS 10-year plan and this plan here. Fantastic, and a lot of people agree on it, but the lack of delivery and the delivery chapter is really important. So if we go to the quotes from the Action for ME, for example, that said, the plan also lacks clear accountability structures with no mechanisms to measure impact or deadlines to hit. We are concerned that despite this well-meaning plan being published, it will have no material impact on the historical stigmatised and ignored ME community. Action for ME want to work with MPs, ministers and officials to improve the implementation. They went on to say the delivery plan on ME CFS fails to include a strategic approach to ME research. But they weren't the only group, Chair.
The ME Association said, and I quote, "There is no clear ambition or strategy to drive consistent implementation of NICE guidance recommendations across ICBs." They went on to say severe and very severe ME received minimal attention despite known risks during hospital admissions. And they finally said several of the plan's own deadlines have already passed and it's unclear what progress has been made. In my short time, Chair, I want to focus my questions, therefore, on two areas: action and accountability. The first is the questions that those living with ME will have, and particularly when it comes to the changes around DWP and what that will look like. With the imminent TIMS review, I'd be grateful to understand what the government is doing to discuss between both departments what this will look like, given the scale of the problems we have heard facing the 400,000 people plus in this country. The second of all is when we turn to the actual plan itself, is looking at what the actions will be delivered. And I'm keen to look at the section which was called after publication of the FDP, because it went on in it to say, we will monitor the actions included in it. The DHSC Secretariat will continue to engage with the task and finish group in an appropriate form as required. Well, given the debate today, is that required and what form will it take? The document also goes on to say that a subgroup will be created to focus on improving care for those with ME and CFS. Has that group been created and how many times has it met? And further, it goes on to say we recognise the needs of those with ME, CFS, and we remain dedicated to developing our approach as new research emerges and we seek further engagement. Could I press the Minister on what that engagement is, who is it with, and what does it look like? Because at the end of the day, there is a plan here, we do agree with it, but it's the actions and accountability within it that is truly going to make a difference. And in closing, on that basis, ME may challenge the body, but it never diminishes a person's worth or their hope that they carry. And that's critical when we've got such a great plan. It's the action that's going to take it forward.
Minister, to wind up, and if you leave a minute at the end, then Ms Munt will be able to conclude the debate.
Thank you, Mr Mundell, and it's a pleasure to serve under your chairship. I'd like to congratulate the Honourable Member for Wales and Mendip Hills on securing this debate and pay tribute to her for her continued advocacy on behalf of people living with myalgic encephalomyelitis. Her work has ensured that the voices of those affected are heard at the highest levels of government, and I am happy to accept her invitation to meet with her and stakeholders, and that of my honourable friend, the Member for Lee, as chair of the APPGs. And I'd like to thank all honourable members that have made contributions today. And particularly acknowledge all of your constituents that you have referenced. They all deserve the very best of care from our NHS. I will endeavour to respond to as many of the issues raised as I possibly can. If I have not covered it, then my officials will take notes and will follow up in writing afterwards. I will very quickly.
I'm really grateful to my honourable friend. We know that at the heart of this, we need to ensure that all clinicians have a basis of training, and that certainly is missing at the moment. We see misdiagnosis, we see some of the provision, including fatigue clinics, providing the wrong interventions. Will she ensure that there is a strategy around training clinicians and making it mandatory?
I thank my honourable friend for her intervention, and I will come later in my remarks to cover the training that is being rolled out as part of the delivery plan. So, myalgic encephalomyelitis, it's so difficult to say, isn't it? Encephalomyelitis, better known as ME, for good reasons, and chronic fatigue syndrome, and I refer to it as ME-CFS from now on. It's a condition that affects an estimated 390,000 people in the UK. Its symptoms can be profoundly debilitating, impacting every aspect of daily life, from work and education to family and social life. For those with severe or very severe ME/CFS, even basic tasks such as sitting up, eating or speaking can become impossible. We recognise the devastating impact this condition has on individuals and families. For too long, people with ME, CFS have faced stigma, misunderstanding, disbelief and inconsistent care. And I want to... I will.
Thank the Minister for giving way, and I know that she's a passionate advocate for women's health. Would she agree with me that it's because women are 5 times more likely than men to get this disease, that are often overlooked, the stigma that she's talked about has been faced? And will she be supporting clear funding, accountability and deadlines within the very welcome plan that's been delivered, and a service for very severe ME for all ICBs?
My honourable friend for her intervention, and I recognise the points that she makes. I will be covering some of those in the rest of my remarks, and will also say that she will be aware that the Women's Health Strategy is currently in the process of being refreshed, and so we hope to dovetail wherever possible. I want to set out the steps this government is taking to change the misunderstanding, the stigma and the inconsistent care that patients have experienced through our ME CFS final delivery plan to deliver better care, boost research and ensure that every person living with ME CFS is treated with dignity and compassion. First, let us acknowledge the reality. ME CFS is a complex multi-system condition. Its fluctuating nature makes diagnosis and management challenging. Historically, services have been extremely varied, and in some cases, patients have felt dismissed or rejected by the healthcare system, and it is unacceptable. We have heard these concerns loud and clear through our extensive consultation on the interim delivery plan, and through ongoing engagement with patients, carers, clinicians, researchers and charities. Last year's Prevention of Future Deaths report following the tragic death of Maeve Boothby O'Neill further highlighted the urgent need for reform, pointing to a lack of specialist beds, inadequate training for clinicians. We cannot and we will not allow such failings to continue. In July, we published the ME CFS Final Delivery Plan, marking a significant milestone in our commitment to improving lives. The plan is built around 3 core themes: boosting research, improving attitudes, and education and enhancing care and support. With a clear commitment to ensure that people with ME CFS can live as independently as possible and see their overall quality of life enhanced. This plan will help us take an important step towards achieving this. But we acknowledge that there is more to do, and we will continue to build on the foundation of these actions well beyond the publication of the plan. It is the springboard, the beginning, not the end. Whilst the final delivery plan does not include every suggestion received through the consultation responses or through the Task and Finish group, it does not mean these proposals will not be considered in the future, subject to resource and funding, and we look forward to continuing those conversations. I shall.
Yeah. Will they be meeting again then to consider that?
Yeah, I will come to that. Thank you for his intervention. I will come to the Task and Finish group in my remarks. But first, research. Research is the key to unlocking better treatments and improving quality of life. As has been mentioned already in the debate, we've seen progress through projects like Decode ME, the world's largest genetic study of ME CFS, funded by the National Institute for Health and Care Research and the Medical Research Council. Preliminary findings from the study indicate genetic differences in 8 areas linked to the immune and nervous systems in people with ME CFS. This discovery of specific genetic signals may help us understand the biological pathways involved in ME CFS in the future. But we need to go further. And that is why the plan includes a funding offer and a commitment to continue working with researchers, industry and patient groups. New awards announced this year include funding for repurposed treatments and $845,000 for a large infrastructure project called PRIME, or to give it its full name, Building Infrastructure for Patients, Researchers and Industry for ME CFS. Together with the MRC, we're actively exploring next steps in ME CFS research. For example, earlier this month, we co-hosted the Research Showcase event for post-acute infection conditions, including ME CFS. This brought together people with lived experience, researchers, clinicians and funders to help stimulate further research in this field. We're now considering the discussions that took place at this showcase to explore the next steps to stimulate further research. The outputs of this event will be circulated as soon as possible. The final delivery plan also sets out actions to improve access to specialist services, to provide better support for children and young people and their families, and to address employment challenges. And it aligns with our 10-year health plan, which includes the rollout of neighbourhood health services, bringing care closer to home and ensuring multidisciplinary teams can support people with complex conditions, like ME, CFS. We know that provision varies across the country, and we're determined to reduce these inequalities. The final delivery plan includes actions to improve service mapping and workforce training, so that every patient, regardless of postcode, can access the care they need. NHS England is working closely with the department to support ICBs in commissioning equitable, evidence-based services. In fact, two of the most important actions in the delivery plan are focused on NHS services. NHS England has already started its work on co-designing resources for systems to improve services for mild and moderate ME/CFS. And it will meet... I will.
NHS England is due to be abolished. Who will be taking that on?
I will come to that. Actually, whilst NHSE is in the process of being dismantled, all of its functions continue, and the new Department for Health and Social Care will continue with all of their work. None of that is being got rid of, it's simply being brought together into a more efficient new Department for Health and Social Care. And that department will continue to explore, to meet a group of key stakeholders to move the work forward in terms of the mild and moderate ME/CFS in the coming weeks. Additionally, I can confirm that the DHSC has already started conversations with NHS England to explore a specialised service prescribed by the Secretary of State for Health and Social Care for very severe ME/CFS, and that work will continue. Changing attitudes is as important as changing services. Too many people with ME/CFS have faced disbelief or stigma. As outlined in the plan, we will address this by launching a public awareness initiative to improve understanding of the condition and the support available. And we'll be working with schools, employers and social care providers to ensure children and adults with ME/CFS receive the information and support they need. I won't give way as time is very short. To support healthcare professionals in the diagnosis, as set out in the final delivery plan, the department has worked with NHS England to develop an e-learning programme on ME/CFS for all healthcare professionals. The aim is to support staff to be able to provide better care and improve patient outcomes. And this plan was not developed in isolation. It reflects thousands of consultation responses and the input of the cross-sector task and finish group. We have repurposed the task and finish group into a new post-publication stakeholder engagement group, and we look forward to working closely with them during the all-important implementation phase. I recognise that some stakeholders feel the plan does not go far enough, but let me be clear, this is not the end of the journey. This is simply the foundations. And our work does not stand alone. It stands on the broader ambition to transform the NHS from a sickness service into a health service. We are working with the DWP and the Department for Education to ensure that all of the issues raised are considered, particularly during the TIMS review. Because ME/CFS has been overlooked for far too long. We're determined to change that. And to everyone living with ME/CFS and to your families and carers, I say this. We hear you, we value you, we believe you. And we are committed to making the system work better for you and with you. Together we can build a future where everyone receives the care, respect and support they deserve.
Tessa Munt, you have 1 minute to wind up the debate.
Thank you, Mr Mundell. I have very little to say. I am delighted to hear what the Minister has to say. I will be holding her feet to the fire. I wish to continue on this campaign and I will work with others. One of the things I omitted to say at the beginning of this was that actually I am a member of the APPG for ME, of course, but I should have declared that at the beginning. I seek your forgiveness, Chair, for not having said so. I am delighted with a number of the things that the Minister has been able to say, but I think what I would do is I'd thank everybody who'd contributed to the debate, and probably I should have asked for 2 or 3 hours, really. I'd like particularly to point out the previous Secretary of State. I think it was his phrase, now the member for Godalming and Ash, it was his phrase about digging for treasure, I think. And I think what I would say is it's so moving to have heard so many very important stories of people who are suffering, and we really have to do something about this. Thank you, Chair.
Yeah.